is Miss Christina, and today I'll be taking care of you.
Hi,
Is that fine?
Yes, ma'am.
Can you please tell me your name, ma'am?
My name is Greta Vasquez.
Okay. I think the breakfast is ready right now, and I'll bring it to you. Okay?
Oh, okay.
Okay.
Yeah.
I'll be back in a minute.
Okay, thank you.
Mhm.
Come in.
Hello, Miss Greta, Miss Vasquez. Are you ready for your breakfast?
Yes, ma'am.
How have you been doing this morning?
Well, I still feel like, I'm still having difficulty swallowing. This is what I'm gonna eat for breakfast?
Yes.
But I don't think I can swallow this because I'm still having a hard time. I feel like something's stuck in there and that cannot, that impedes me to swallow. So are you sure?
Yes, your order said that you have a regular diet.
A regular diet?
Yes.
Okay, well then I trust you because you're the expert.
Okay, I'll be here with you.
Okay.
You'll be okay.
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 Thank you.
You okay? You okay, Ms. Vasquez? You want some water? Are you having trouble breathing? Okay, let me call a doctor, okay? Dr. Sanchez!
Yes, what's wrong?
I gave her
Vasquez.
breakfast and she's having trouble breathing.
Was she? Did
She has some...
she ask for it?
I think so.
Alright, let's get her to the table.
Okay, go ahead, ma'am.
The bed. Okay. So in this reverse case study, we're going to talk about the importance of communication. As you guys just saw right now, it can lead to very bad negative consequences. So what I'm going to talk about is, or what we're going to present is what happened 5 hours previously. So remember, always communicate with your team members and ask questions. If you think something is wrong or something's off, make sure to ask, and always do your assessments. And yeah, we're all in this together. Working together will prevent us from making mistakes like this.
Hello everyone. Today we're going to present a case study about a patient who had a stroke leading to mild dysphagia that is transferred from an acute care facility to a long-term care facility. The patient is put on a food diet and subsequently aspirates, leading to respiratory compromise and readmission to the hospital. The healthcare provider blames the LPN in charge of the patient's care at the time. We hope you enjoy this case study and have a great learning experience.
Come in.
Hello, Ms. Vasquez. This is a speech pathologist,
Hi.
Andrea, and today I'm here to assess you for your swallowing, okay?
Okay.
So how have you been?
I've been the same. I have sometimes I have difficulty swallowing even water.
So also with liquids and water?
Yes, and also with liquids. So.
Okay, so let me assess you so that we can provide you the best care, okay?
Okay.
So first, I'm gonna ask you to move your jaw to the front, like protrude it. Okay. Can you please do like a chewing movement? Okay, so Can I see your teeth? Can you please open a little bit your mouth and picture your tongue? Okay. Can you please smack your lips? Okay. So let me bring a cup of a little bit of water to check the how much difficulty you have. All right?
Okay.
I'll be back in a minute. Hello, Ms. Vasquez, I'm back.
Okay. Okay.
So I'm gonna make you to drink a little bit of water
Okay.
and see how it goes, okay?
Okay.
You okay?
Yes.
Can you please open your mouth? Can you picture your tongue? Okay. Okay, ma'am. So yes, you have a little bit of difficulty swallowing, which is an effect of the stroke you had. So we're gonna make sure we put you on a thick and liquid diet, okay? So it's very important for you to follow that diet to prevent any aspirations and any respiratory compromises and complications with your breathing. Okay?
Okay.
Okay, so
So they're gonna change my
yes,
diet?
I'm gonna make sure to tell your healthcare provider to make the order in your medical records.
I
Okay?
appreciate it.
Okay.
Thank you.
Yeah. No. Listen, that PICC line needed to be changed yesterday.
hurry
We
up.
cannot be having that PICC line anymore. He's gonna get an infection. No. Like it's been way too long. No. I understand. No. Oh my gosh. Are you serious right now? Really? Okay.
Dr. Sanchez.
Wow. Yeah.
Okay, so we talking about the patient on room 305, Ms. Vasquez.
Mhm.
She had some problems swallowing
Okay.
while doing her assessment, so I want to make sure to change her to a thick and liquid diet prior to her discharge. Okay?
Yeah, that's fine.
So-
whatever you have to do.
It's important to do it before her discharge,
Yeah.
so that she will be on good conditions on her long-term care facility.
All right. Yeah, that's fine.
Okay?
Yeah. All right.
Do you have any questions?
Yeah. I was saying. Yeah. I need that PICC line changed tomorrow.
Do you have any
If
questions?
not by tomorrow, no, I'm good.
Okay. After a long day, the healthcare provider went to his office to input the new recommendation of a thick and liquid diet for the patient who had dysphagia.
Yeah. That patient can be discharged. There's no signs of infection. All signs are good. Yeah, he can be discharged. Yeah, okay. Bye. Alright. Oh my god, what a day. Let me see. What did the speech pathologist tell me? I forgot. I think she said regular diet. Okay, I'm just gonna put regular diet. Regular diet. Done. Alright, looks like Ms. Greta is ready to get discharged to this long-term facility, so let me make that phone call so I can make report. Okay. Yes, hi, hello. My name is Sergio, the RN taking care of Greta Vasquez. I'm calling from Edinburgh Regional Hospital. Patient was admitted for CBA. She is planned to get transferred to your long-term care facility within the next 2 hours or so. Yeah, so Greta Vasquez arrived in the ER March 22nd of 2021 this year, of course, due to a stroke. This is the first time she experiences this. She has a medical history of hypertension, diabetes mellitus 2, coronary artery disease, and hyperlipidemia. She has no known allergies. She is gravida times 3 and para times 2. She might need help with feeding since she's left-handed. Let me see. I believe. Wow. Okay. I guess she's on a regular diet now. Yeah. So she's on a regular diet. Greta Vasquez currently has a temperature of 98.6, a heart rate of 75, a respiratory rate of 18, blood pressure of 156/87. She's a little bit hypertensive right now. And SpO2 of 100% in room air. Her potassium it's a tad low at a 3.4, and her sodium is a little bit high, 146. Right now she's currently alert and oriented ×4. She's able to ambulate, but it's a little bit weaker on her left side, so she might need help with feeding since she is left-handed. Let's see. What I need from you is to assist her to do her activities of daily living. She might need help with feedings and showering. I would also keep assessing her swallowing since she still has difficulty swallowing from what I heard from the speech pathologist earlier. Please bring the patient back if she experiences signs and symptoms of a stroke, such as a drooping face, weak arms, and speech difficulty. Also, if respiratory compromise develops due to aspiration related to the dysphagia she's having. Any questions? Okay, so going back from where we started, the patient had a complication. She aspirated, and now as a healthcare provider, I'm going to assess her and see what went wrong and what we can do to improve. Okay, so in this next clip, I'm actually the doctor at the long care facility, not the first one, the acute. So I'm actually compassionate caring, so I'm not the same doctor, just letting you guys know. Okay, Ms. Vasquez, how are you feeling right now? I'm gonna check your swallowing real quick. Can you swallow to me?
Okay.
Can you swallow one more time? Open your mouth. Say up. Alright, I'm gonna check your brain real quick. Take your breath.
Heart rate is 107.
It's not looking too good. I think she might have to get transferred back to the facility. Yeah, take your fluid for lungs. Might be pneumonia.
Yes, her blood pressure is 145/89.
Christina, can you come here?
Yes, doctor.
So what happened over there?
Okay, so the patient had her breakfast
Okay.
and she started to aspirate.
Oh,
She had a regular diet on her medical records.
regular diet. Are you kidding me?
Yes.
She clearly can't swallow. She is
And
recovering from CVA.
her arm told me that when she gave me the report, she told me that her diet was irregular.
Did anyone assess her?
No, she wasn't assessed prior to her breakfast.
Oh my God. This could easily be prevented.
Hi everyone, my name is Greta, and in the case study I play the patient. Just a word of advice. This is from a patient's point of view. Pay attention to the patient's concerns rather than what is written on the medical record. Pay attention, listen to the patient, be an advocate for the patient, because really you are going to be there and you are going to be the one assessing the patient. So listen, pay attention. Like they say, the patient is the only one that can define pain. So if the patient tells you that they're hurting, don't come out with your own conclusions. Rather assess the patient and follow the orders that the doctor puts. This message of the case scenario was very clear. Lack of communication, effective communication, lack of listening actually play a big role that could have been prevented. The patient ended up developing pneumonia, and she had to go back to the hospital. And this could have been prevented if someone would have paid attention to the concern. Just let's be advocates of patients once we are out there, because we are soon to be going to be out there in the real world, and it's important that we provide the care in a compassionate and empathetic way, and most important, just listen to your patient. Thank you.